Welcome to our debate. The topic of our debate will be, should a free and appropriate public education or FAPE include mandatory ABA services for children and youth with ASD in schools? My name is Morgan. I'll be the moderator today. Sinclair will be their stater. Ellen will be the prover, and Karen will be the attacker. Before our debate gets started, we'll go over FAPE and ABA. FAPE, or Free Appropriate Public Education, is the educational right of children with disabilities in the United States that is guaranteed by the Rehabilitation Act of 1973 and the Individuals with Disabilities in Education Act, IDEA. It guarantees that all eligible students with a disability will receive a free public education that is individualized for them. Applied behavior analysis is the process of systematically applying interventions based upon the principles of learning theory to improve socially significant behaviors to a meaningful degree and to demonstrate that the interventions employed are responsible for the improvement of the behavior.
Our first point in the debate is the theoretical and practical issues relevant to special education.
First, many children are being diagnosed more and more, especially with autism. Autism is on the rise overall, and students with ASD are in our schools. The Center of Disease Control states that 1 in 68 children are diagnosed with autism.
And that point is true, but schools are already spending nearly 2.5 times as much on students with disabilities as they do to educate students without disabilities. According to the New York State Association officials, they put on a research called the Education Dollar, and they estimate that the added costs of autism spectrum disorder related education for each child to be over $18,600 per year.
Another point, students with IEPs should receive any therapies deemed appropriate. And this should be provided by the school system due to FAPE, whether it's speech, occupational therapy, or ABA. Research shows that 40 to 50% of the ASD children can learn enough to go back to mainstream general education classrooms if they receive high quality, intensive evidence-based interventions early on. Levis found that 47% of the experimental group achieved normal intellectual and educational functioning.
Well, unfortunately, many school districts do not have the money or the resources to provide all of the different types of interventions that are evidence-based. School districts should have the right to choose interventions as long as the outcomes are good for students with autism spectrum disorder. The National Standards Project Phase 2 rigorously evaluated the quality of science and intervention effects for many different interventions for children and adults with autism spectrum disorder. According to their findings, numerous interventions are established for use with school-aged children with autism. For example, behavioral interventions, cognitive behavior therapy, package, scripting, self-management, and story-based interventions have all been shown to be effective for these populations. These interventions have been shown to increase many different skills, and they can be taught by special education and general education teachers and paraprofessionals and other support staff at the school with good results.
Another point, the school is often the only choice that these families have to provide services for their child. Services are limited in urban areas, and this makes resources even more difficult to find in rural communities. These maps show that there are fewer BCBAs in comparison to teachers, which can imply that ABA centers are very limited if schools are the only choices.
And schools do not have the unlimited staff and resources to train people in ABA therapy. Most children should have access to private insurance as well, and they also might have access to Medicaid or other state-funded behavior therapy services that can provide the specific consultation to the school district on a per student basis. States that have rural populations might also be able to access ABA consultation via a telehealth model. ABA therapy does not have to be provided by the school district. Parents can find other resources to help them provide ABA therapy for their children.
Finally, the schools must provide FAPE under IDEA, which is unique to each child. Those with ASD must have the option of getting these services at school. Students may receive a specially designed instruction, work on math at their level with a smaller group during a general education math class. A test can be read to a student. FAPE being under IDEA can implement an individualized education plan, the IEP, which will state the services and goals for the student. And this also should include a least restrictive environment. A student will be with a typical learning classmates. He can get speech sessions, occupational therapy, counseling, and transportation can be utilized under FAPE. I work with a client and he receives 2 speech sessions from the school every week. He receives occupational therapy every other week, and he engages with the general education class. He can participate in a small group of his peers that work just on reading and math, and he's able to take turns and interact with the smartboard and get more practice being in the smaller group with his letters and numbers than if he was in the big general education classroom.
And there are various ways of ensuring FAPE, and each IEP team has their own interpretation of FAPE. According to the Hendrick Hudson School District versus Rowley Supreme Court decision, the court actually determined that the purpose of IDEA was to give students with disabilities access to public education. The idea behind IDEA was not so much to address the quality of the education once the students received access. According to the National Center for Education Statistics, over 6.7 million or 14% of public school children have individualized education programs or IEPs. Of those 6.7 million children, 22% of them, or almost 1.5 million students, qualify for services under the categories of autism, developmental delay, emotional disturbance, or they fit under multiple disability categories. And laws for special education services must be broad enough for school districts to be able to comply given the current resources that school districts have. If it is mandated that schools must provide ABA services for students, that may open the door to more and more families requesting expensive and complex services for their children.
Next, we will discuss the pros and cons of special education services.
Students must qualify for services due to medical diagnosis and rigorous testing. So determination for the services of ABA professionals is valid. School psychologists, if available, can provide this diagnosis.
There is some disagreement, even amongst BCBAs, about which treatments will work for specific clients. ABA is expensive, it is challenging to implement in rural areas, and it's not the only intervention that can be utilized for children with autism spectrum disorder. AutismSpeaks.org is a website that asked over 28,000 parents of children with autism which therapies those parents actually deemed most effective for their children. And according to the results of Autism Speaks, ABA was only the third rated intervention at 15%. So public schools often do already provide 3 out of the 4 of the top rated interventions according to parents. Those include occupational therapy, speech therapy, and also social skills classes.
But providing special education services within the school setting is beneficial to students. They do not have time to find time outside the school day. There's transportation issues, issues like that. And early intervention research shows that 20 to 30 hours of intense therapy is necessary for positive treatment outcomes. And this is very difficult to do outside of school hours.
And Lovaas actually wrote that when ABA is implemented for 40 hours per week for 2 years, children can attain higher cognitive functioning and they are able to perform in school with minimal supports. However, schools must also give students an academic education according to increasingly rigorous standards that are adopted by states, such as the Common Core standards. For example, I am an elementary school general education teacher. And in my school, there's an average school week would contain about 24 hours or 25 hours of actual academic instructional time. And if a child is receiving the recommended 40 hours of ABA therapy per week that Lovaas actually recommended to achieve the results that he intended, there would still be like a 15-hour a week deficit that would even be available to teach academics. And school districts are not, they provide behavioral therapy, academics must also be taught. Therefore, ABA is really not best suited to be delivered in a public school setting.
So schools need to provide special education services for both academic and behavioral issues. If the behavior and disability impacts their education or the education of others. And help with data collection, including the function of behavior assessments and functional analysis. A teacher has normally 20 plus students to attend to, and taking data may really be difficult.
And many teachers actually disagree when a BCBA comes in and gives an analysis of the behavior. Many teachers believe that they also understand students' behavior and they feel that they can affect positive behavior change using their own methods. ABA is not always used with fidelity by school staff. Even when a BCBA develops an intervention plan and consults with a school on a plan to be used within the school setting, implementation, validity, and reliability is often very low. BCBA consults with a school, they are not actually the ones that are implementing the intervention. School staff that can include special education teachers, general education teachers, and also paraprofessionals are often not experts in behavioral analysis and implementing the complex interventions. Many elements, such as the beliefs of the staff in a school, the attitudes of the teachers in a school, the demographics of the children who are serviced by the school, and also the general education level of the staff might interfere with the actual implementation. And all of those factors are beyond a BCBA's control. And this can cause a breakdown in treatment fidelity over time.
In conclusion, for this point, schools should not be limited to providing academic services to students. Behavior services are also a must for students with disabilities. 20 to 30 hours a week is needed to make progress with the students. ABA has been proven to modify students' behaviors, and giving the opportunity to have ABA therapy at school, behaviors could significantly decrease.
And also in conclusion, behavior services do not have to be provided by a BCBA or include ABA to be effective for students with autism spectrum disorder. Courts have ruled that behavior services may be effectively provided by a highly qualified special education teacher, a general education teacher, or also a paraeducator, as long as the paraeducator is supervised by a highly qualified teacher.
Next, we will discuss the special education law and any relevant litigation for historical context.
So our first point, students with disabilities have rights under FAPE, which is least restrictive environment, and the IDEA. So FAPE, to be appropriate, education programs for students with disabilities must be designed to meet their individual needs to the same extent that the needs of non-disabled students are met. An appropriate education may include regular or special education and related aids and services to accommodate the unique needs of the individual with disabilities. One way to ensure that programs meet individual needs is through the development of the Individual Education Program, IEP. IEPs are required for students participating in the special education programs and of the recipients under the IDEA. And then the least restrictive environment under IDEA, the child with disabilities is to be in the least restrictive environment, and this can be in the general education class with an aide to assist when needed. The removal of a student from a classroom to a special class or separate class is only seen necessary if the child's education will not be met, and removal is more beneficial for the child.
And while there are specific laws concerning IDEA and FAPE and least restrictive environment, there are actually no federal or state laws that state which interventions have to be used within the school setting. According to a very recent Supreme Court case, which was Andrew F. versus the Douglas County School District, RE1, this was decided by the Supreme Court of the United States just this past March of 2017. And the court came to a unanimously agreed opinion. And that was authored by Chief Justice John Roberts. And he authored it to say, and this is a quote from him, to meet its substantive obligation under IDEA, offer an IEP that is reasonably calculated to enable a child to make progress appropriate in light of the child's circumstances. And the court ruling also reflects a recognition that crafting an appropriate program of education requires prospective judgment by school officials. So basically what that means is that the IEP team, which includes the school staff, the parents, and other professionals, must work together to find an IEP that is workable, and that school officials have the final judgment in what constitutes an appropriate program. According to Chief Justice John Roberts, the IEP must enable the child to make progress. And he also stated in his opinion that an IEP should be reasonably calculated to enable the child to receive educational benefits. And this does not promise any particular modality of treatment or any specialized intervention. The court's opinion stated that any review of an IEP must appreciate that the question is whether the IEP is reasonable, not whether the court regards it as ideal. And that is a really important point to make, is that school districts do have the ability to decide what is reasonable for their school district according to IEP. The court's unanimous decision also stated that the adequacy of a given IEP turns on the unique circumstances of the child for whom it's created. And so, therefore, the court has made a judgment that individual IEP teams and school districts, not the courts or the parents themselves, have the right to determine which services are implemented on IEPs.
Many parents have sued school districts for not providing services, causing the district to lose money in court costs or to send students to private schools and private clinics for therapy. If ABA was provided by schools, less potential to be sued by parents, since ABA is shown to be very effective with those diagnosed with ASD.
And according to another seminal court case that was regarding FAPE, and it was brought to the Supreme Court by Rowley versus the Board of Education in 1982. And the court's decision at that time was that as long as a school district complies with the IDEA's procedural requirements and the IEP is developed through the Act's procedures and it was reasonably calculated to enable the child to receive some educational benefits, then the school district is complying with FAPE. And this judgment by the Supreme Court has been cited in close to 4,000 other court cases in the past 25 years. The judgment states that IDEA's purpose is not to allow each child to achieve their full potential, but to ensure that students with disabilities have sufficient resources and equal access to education.
Next, we will talk about some ethical dilemmas facing special education and other professionals serving students with ASD.
Okay. Everyone working with students are ethically bound to do what's best for students. There are many interventions and alternatives for the school district, but ABA has shown the most promising results for those with ASD. The BACB Code of Ethics 2.09, the Treatment Intervention Advocacy, states that clients have the right to the most effective treatment. It is the BCBA's duty to lobby for the right amount of hours needed for the client.
And practitioners also must be ethical in a world of fad treatments. And ABA is not the only ethical treatment for individuals with ASD. As we stated earlier, there are actually many interventions, according to the ones that were deemed effective by the National Standards Project, that are also preferred by parents.
School districts should ethically give students the best education they can. The teachers have a code of ethics for education. Principle 2, ethical conduct towards practices and performance. They also have the professional educator assumes responsibility and accountability for his or her performance and continually strives to demonstrate competence. Another ethic that they have is the professional educator endeavors to maintain the dignity of the profession by respecting and obeying the law and by demonstrating personal integrity.
And school districts around the nation choose their own curriculum for academics. One of the reasons why our nation does not have a completely government standard education and set of academic standards is because the voters in the United States and the parents of children realize that not one size fits all. And they should also have the right to choose therapies for students with ASD. Therapies for ASD should be individually tailored for each child. And the individual school's IEP team has the right to decide which therapies best fit the child. They need to be able to ensure that the therapies that they choose that are effective for students with autism spectrum disorder fit into the financial and staffing capacity of the school district, and also the feasibility of the long-term treatment fidelity.
Excuse me. Schools ethically must staff people who are adequately trained in ABA in order to effectively develop plans for challenging behaviors that are impeding students' ability to learn. BAs will follow the BACB Code of Ethics and ensure students are getting the correct and fair treatment.
And fortunately, schools often do employ individuals, and that can include special education teachers or counselors who have training in PBIS, so positive behavioral supports, or other teaching methodologies for students with challenging behavior. And most new teachers who have recently graduated from college or the university system, they do have familiarity with positive behavior supports, and they can implement them with more fidelity than they can with ABA. And many other special education and classroom teachers have also received extra training in PBIS through additional coursework, but they may not have had training in ABA therapy.
Educators, therapists, and any persons involved with students' education must abide by ethical principles.
Now let's compare research and literature on ABA and alternative instructional methods or interventions.
Okay, the first point, evidence-based intervention for individuals with ASD. The classic study that Lovelace did is cited in the Surgeon General report, demonstrated that with appropriate intervention, children with autism could make intellectual and social gains. This was seen previously as impossible. The study included an experimental group of 19 children and 2 control groups, totaling 40 children. The 3 groups were similar in relevant pre-intervention measures. The treatment differed mainly according to the number of hours of educational treatment, with the experimental group receiving at least 40 hours of one-on-one training a week. In the control group, the participants received 10 hours or less. The differences in outcomes between the groups were profound, with 47% of the experimental group participants achieving IQs exceeding 100, as compared to only 2% of the control group students. In addition, several of the experimental group participants were successfully mainstreamed in regular classrooms. Another point, Howard, Sparkman, Cohen, Green, and Stanislaw did a study that lasted 14 months with a group of preschoolers. There were different groups receiving different therapies. One group used intensive ABA strategies, while another had eclectic treatments, which is a delivery of various treatments approaches based on the judgment of the interventionist, rather than just a one type uniform treatment. The group receiving the specialized intensive behavioral intervention, ABA, received much more results than the other groups of higher quality, given the level of supervision and training, and it had begun sooner. This group made significantly greater gains than the comparison groups over the 14 months of the study in all areas, except for motor skills. These finds point to ABA as the most successful intervention.
And while ABA is a successful intervention for students with autism spectrum disorder, ABA is not the only intervention for individuals with ASD. According to the National Standards Project Phase 2, and this group looked through many, many decades of research and went through them with a fine-tooth comb and able to establish interventions that are effective for children under the age of 22. And these established interventions, as determined by the National Standards Project, include many that can be very easily implemented in a low-cost way for school districts. Behavioral interventions, modeling, schedules, natural teaching strategies, story-based interventions, the peer training package, and self-management are all easier to implement and are much more cost-effective than ABA.
ABA must be adopted at the district level for students with ASD, and staff need to be trained on ABA. This will allow for consistency across schools and classrooms, and this will help keep all staff consistent with treatment fidelity and will ultimately be higher, allowing for better treatment outcomes for the students.
And while ABA does allow good treatment outcomes for students, there are very little monies that school districts have for professional development. Many school districts are completely untrained in ABA techniques, and it would be very expensive for a school to train enough individuals in ABA for interventions to be effective long term. And if the implementation of ABA does not include very rigorous and frequent fidelity checks by a BCBA, the intervention likely will not be as successful as it was written to be. In order to be successful, it would be very time consuming and very costly. According to Kamau in 2014, the National Association of State Directors of Special Education and the U.S. Department of Education's Office of Special Education Programs had a survey results that show that ABA faces some factors that actually hinder its adoption within the school districts, including the implementation of ABA and also the maintenance. Some of those factors that would inhibit its adoption, implementation, and maintenance include an extreme shortage of staff who actually have training with students with special needs, a lack of agreement amongst teachers, administrators, and other school staff about which exact intervention methods would be most successful, and a general lack of funding for professional development for teachers and paraeducators.
Having ABA in schools can help find motivation for the student to learn. It can break down work tasks and give frequent reinforcement to decrease the student's challenging behaviors. Oftentimes, we see an increase in challenging behaviors when students are not motivated. Individualized program will help eliminate this lack of motivation.
And another intervention that is very successful with that is cognitive behavior therapy. And that has been effective in reducing challenging behavior in students with autism. A study by Wood found that cognitive behavior therapy was actually a very promising intervention for students that have high functioning autism. According to their research, cognitive behavior therapy helped actually influence students' social communication deficits. Parents also reported lower autism symptoms overall in their children after the cognitive behavior therapy study.
Overall, ABA has shown much promise and progress for those on the autism spectrum disorder. There are many techniques and trials to help an individual with ASD to gain necessary skills in the academic and functional settings.
Now we'll talk about the potential role BCBAs play as collaborative partners and what their duties are.
BCBAs can provide the school district with tools to promote ABA therapy. A BCBA can work closely with the school to provide conjoint behavioral consultation that promotes relationships between family, school, and the BCBA. A BCBA can work closely as collaborative partners with all the stakeholders that work with a child in order to identify the needs of a child, prioritize those needs, determine the data collection procedures, and develop intervention plans that provide the ABA services that students need to make for improvements in the socially significant behaviors. A BCBA is also able to then determine that those interventions are ultimately responsible for the behavioral change.
And one of the things that we found in our research on BCBAs is that the number of BCBAs and their proportion with the country in general is very different. For example, in the state of Pennsylvania, there are over 1,200 BCBAs. In Wyoming, there are only 11. And in the entire island of Puerto Rico, there are only 5. And there's a nationwide shortage of board certified behavior analysts. One of the reasons behind this is because many states do not have higher education colleges that actually have a plan that is accepted by the BCBA as an approved course sequence. So many people who would like to get a BCBA are actually not able to do that without going out of their own state. This can be very expensive and difficult for a lot of people to do. According to Mason and Gallegos in 2013, rural areas in the United States have far fewer BCBAs than metropolitan areas. And many rural schools are not going to be able to find a BCBA that can successfully implement an ABA program in their school district. We have also talked about if rural school districts rely on BCBAs that can rarely visit their school district to consult, or on telehealth modalities, they will not be able to effectively implement the ABA services for students in a lasting way that will actually result in effective interventions for children.
That could be true, but a BCBA has the tools and training to accurately analyze behavior and develop interventions. Also, BCBAs continue their education yearly and are always up to date on the most successful interventions.
And school districts can also do this too with their own staff. A special education team can also provide behavior analysis and develop plans for children in schools from a wide array of evidence-based interventions. Every school has a special education team, but not every school has access to a BCBA that can provide these services.
BCBAs can come into the classroom and collect the data necessary to determine the function of the challenging behaviors and develop an accurate intervention protocol. When this is done, it's more efficient than trying interventions and having them fail.
And while it would be ideal if every school district had the resources to provide a BCBA to the school districts, and if there were enough BCBAs in the nation that this would be feasible in rural areas, if the BCBA is not familiar with the culture of the school, the constraints of the particular school environment, and the abilities of the teachers, they can implement the actual intervention as written, then the intervention may not be successful long term, and it may not be implemented with fidelity. And one of the things that we know is that for ABA to be effective in students with ASD, it must be implemented with fidelity, and it must have rigorous checks by a BCBA. If the BCBA is not familiar with the school, then the intervention may not work for that particular school district or that school.
So overall, BCBAs can be a great resource to help the school solve behavior issues and create successful interventions. BCBAs can have a different perspective, and this will ensure the child's goals are met and behaviors can be monitored.
Overall, in conclusion, ABA services for children and youth with ASD in school settings should be mandatory under FAPE because ASD is on the rise and ABA is an effective evidence-based intervention for ASD. The public school setting is sometimes the only resource that families have to receive services for their child. Students with disabilities have rights under FAPE, IDEA, and LRE to receive individualized treatment, which for individuals with ASD should be ABA. Unfortunately, there are many challenges that school districts face when looking to develop ABA programs within their schools. ABA practitioners can work to support ABA's implementation in the schools by focusing on research to determine how ABA can best be provided in the school setting in effective and efficient ways. Practitioners can also contact state and local governments to support funding for Medicaid and special education funding. And that concludes our debate. Thanks.